Greetings and welcome to today's presentation on cloning and conflicting documentation. In this session is designed for physicians and coders, aiming to enhance your understanding and handling of documentation challenges in healthcare settings. My name is Toni Appleberg Parks, and I am a revenue cycle specialist and health administrator from the United States in the state of Nevada. And it's my pleasure to be here today with this latest lesson in our series of clinical documentation improvement lessons. This is part of our series aimed at assisting physicians to become better documenters and ultimately leading to better quality and compliance in healthcare, along with a more consistent and appropriate revenue flow. So in this presentation, we will cover introduction to cloned and conflicting documentation, identifying and addressing cloned documentation, strategies for resolving conflicting documentation, and impacts on patient care and reimbursement. So let's get into it. In healthcare, documentation is the cornerstone of patient care and billing. Cloning in medical documentation often arises from the misuse of electronic health records, or EHRs, capabilities like copy-paste, which, while designed to save time, it can do that when used appropriately, but it can lead to generic entries that do not accurately reflect patient encounters. Conflicting documentation occurs when different healthcare providers offer contrasting information on a patient's condition, which can lead to confusion and errors in treatment. Understanding these issues is critical because they compromise the integrity of medical records and can have serious implications for patient safety, quality of care, and legal compliance. For example, clone documentation may mislead a healthcare provider about a patient's previous condition. Thus, this can lead to inappropriate medical decisions by that next provider. Similarly, unresolved conflicting documentation can result in misdiagnosis or delayed treatment, also affecting patient outcomes. So the World Health Organization says that first do no harm is the most fundamental principle of any healthcare service. No one should be harmed in healthcare. However, there is compelling evidence of a huge burden of avoidable patient harm globally across the developed and developing healthcare systems. This has had major human, moral, and ethical, as well as financial implications. Clone documentation can be identified through various indicators, such as the repetition of identical phrases or blocks of text across different patient records. As coders, auditors, CDIs, people that review charts, sometimes it feels like we're reading the same chart over and over, but it's actually just a chart that's been cloned into each respective date of service and may or may not have the appropriate changes made to reflect the current condition. So the repetition of identical phrases or blocks of text across different patient records or the same patient record over multiple visits. Such documentation often lacks specific details that are essential for unique patient encounters. A big one, a common one, is something like an update to the medication lists or the patient history, or just, a reflection of what has been rather than just displaying the medications and the history, what has actually been addressed in the current visit. To effectively address this issue, healthcare organizations can do several things. One, implement training programs to educate staff on the ethical and professional standards required in medical documentation, emphasizing the importance of accurate and patient-specific entries. Number two, they can use advanced EHR functions. They can encourage the use of EHR functionalities that limit the use of copy-paste or require user confirmation before duplicating information. And number three, they can conduct regular audits, regularly reviewing records for signs of cloning to ensure compliance with documentation standards. So, for example, just to illustrate this, a healthcare system implemented a program that flagged potential clone notes for review. This led to a 40% decrease in cloned entries within 6 months, demonstrating a significant improvement in documentation quality. So you can see that just something that simple can have great outcomes. Resolving conflicting documentation begins with a thorough review process where discrepancies are identified. And there are some key strategies that can be included and really are imperative to this process. Firstly, establishing clear communication channels. This ensures that all healthcare providers involved in patients' care communicate effectively using structured handoffs or integrated note systems. The next thing is creating a culture of accountability. We should encourage staff to take ownership of their documentation and to seek clarification where discrepancies arise. And third, leveraging technology. Utilizing technology that highlights discrepancies in patient records for further review and resolution just creates a more efficient way to track those things. So thinking of a practical application for this, implementing a daily review meeting where team members discuss and resolve discrepancies in patient records is something that can be done. This results in fostering a collaborative approach to accurate documentation. So that's something to consider. Okay, so let's take a look at the process flow for strategies to resolve conflicting documentation. And the first step in that would be the identification of conflicting documentation. Where is the problem? So we do that through regular audits and reviews, perhaps a CDI or compliance auditor. And then another way to identify would be feedback from healthcare staff. What has your staff noticed? What kind of ideas do they have? And do you have a way for them to address these or things with you, or maybe even anonymously submit suggestions or things that they notice? And finally, alerts from EHR systems can also be great identifiers. They're definitely something to consider. So once we've identified the issues, then we look at steps for resolution. First, the relevant healthcare professionals should be notified. So those who maybe are having the documentation issues. And it may be necessary to hold a consultation to discuss the discrepancies in detail. It really just depends on how intensive or how frequent or how serious they are. And as a CDI educator, I tend to look at whether they are trends, whether it's something that's a common problem with multiple providers or kind of a one-off thing or a couple people, in deciding whether these should be, one-on-one consultations or just ongoing education for everyone. And then once the discrepancies have been discussed, updates to the documentation can occur with agreed upon information. So some ways to do that, some ways to come to the resolution would be through team discussions, collaborative resolution. In my opinion, this is probably the best way. But depending on your organizational structure and how you deal with these things, hierarchical resolution may also be an option, where the supervisor or a specialist or multiple specialists make the decision. And then again, the automated suggestions from the EHR based on the latest inputs. And those suggestions can actually be brought to the previous two teams to make a decision on whether those are relevant or not. Especially, in this day of AI and automation, where some of the feedback we get isn't exactly relevant or applicable. So those things should be looked at carefully. And then once that process is completed, it should be finalized by confirming that updates are made in the patient record, and sign-off has occurred by all involved parties or the key stakeholders in this. And then once that process has been completed, you're not necessarily finished altogether with it. You'll want to continually monitor for new conflicts or things that might have been missed initially. So, the changes may create some new conflicts. So continuous monitoring is also very important. And here we just have the process flow list in text format for you. And if you are interested in having these slides, I will be giving you the contact information at the end, so you can request those from me. So I can provide you with just this list if you prefer, or the slides for the presentation. Okay, so the impact of cloning and conflicting documentation extends into several critical areas. Firstly, patient safety, as we discussed before. The misinformation can lead to incorrect treatments or misdiagnoses, and that can directly affect patient health. Secondly, healthcare costs. Poor documentation leads to increased administrative costs and potential financial losses due to denied insurance claims. This can, some simple piece of documentation missing or misdocumented can lead to a lot of work, a lot of additional work, like for the payer and also for maybe collectors or denial specialists, for yourself, the provider, and others on your end when a claim comes back and has to be appealed, medical records provided, different things must be done to get a redecision on this claim. So when you think of all the people that may be involved in this and all the hours, the potential for financial loss over multiple claims can be quite substantial. And then there's also the legal and compliance risks. Non-compliance with documentation standards can result in legal challenges and penalties from regulatory bodies. And one of the biggest ones is something like overcoding. So a statistical insight for you. Studies show that up to 20% of clinical documentation may contain cloned information. 20%, 1 in 5, which can influence the accuracy of reported healthcare outcomes and the efficacy of treatment plans. Okay, so that's pretty significant. So if we're cloning 1 in 5 patient visits, let's hope we're doing it correctly and capturing all of the relevant changes in information. The impacts on patient care, cloning and documentation can significantly affect patient care in several ways. As we mentioned several times, misdiagnosis. Repeated or inaccurate documentation can lead to incorrect patient assessment, resulting in misdiagnosis. Treatment delays. Conflicting records may cause delays in treatment as providers take time to clarify and verify information. Patient safety. Errors in documentation can lead to inappropriate treatment plans, risking patient safety. So, taking a look at this first graph, we can see hypothetical data showing a year-over-year increase in safety incidents linked to documentation issues, such as impacts on reimbursement. Reimbursement issues arise primarily due to inaccurate or insufficient documentation. Claim denials. Claim denials caused by cloned documentation often fails to meet payer-specific requirements, and so the cloned documentation ultimately leads to claim denials. Audit risks. High rates of cloned documentation increase the likelihood of audits, which can result in financial penalties and revenue loss. Conflicting documentation can delay the billing process and impact revenue cycle efficiency. Okay, so graph 2 also shows us hypothetical data comparing the rates of claim denials and audit flags over several years due to poor documentation practices. Looking at a couple case studies, in the first one, a cardiology department noticed a high rate of cloned notes in patient records. And by implementing targeted audits and feedback sessions, they reduced cloned entries significantly, improving the specificity and reliability of patient records. And in the second case study, an oncology ward faced issues with conflicting documentation regarding patient treatment plans. Through the introduction of multidisciplinary team meetings for case reviews, the ward enhanced the coherence of treatment documentation and thus reduced errors and improved patient care continuity. So as we come down to the end of today's lesson, we'll just summarize what we've gone over. Today's discussions highlighted the pervasive issues of cloning and conflicting documentation in healthcare. We've explored detailed strategies to combat these problems and examined their profound impact on various aspects of healthcare delivery. By embracing these strategies, healthcare professionals can ensure that documentation accurately reflects the patient's condition and treatment, thereby safeguarding patient care, optimizing reimbursement, and maintaining compliance with legal standards. This presentation is for educational purposes only and is intended to provide general guidelines. The information provided should not be construed as legal or medical advice, and none of this information should be used or shared without permission. I'd like to thank you for your attention and open the floor for any questions you may have. You're welcome to leave your questions or comments in the chat. Feel free to share your experiences or concerns regarding documentation practices in your settings by commenting or by emailing me directly. and you'll find my contact information in this slide. And I can see that that's kind of cut off, so that's Tony@applebergconsulting.com. And I will update this slide.